medical diagnoses?
There are different levels how we can use,
Okay.
depends on the knowledge of the practitioners,
Okay.
In general, because I think since fifth Dalai Lama's time, from the 17th century,
Okay.
so this has been practiced very closely,
Since the
medicine.
seventh century?
17th century.
17th century.
century,
Okay. Okay.
So especially when there are some medicines prepared on full moon.
Oh, on the full moon.
Yeah, and we have
Okay.
to rely on a special date for collection of plants and some preparations on a particular
Collection of
date.
plants. Yes, on a special
For
time.
instance, this
Yes.
is one thing,
Uh-huh.
And one most important thing is when we do the external therapies, let's say bloodletting, mouth abortions,
Okay.
and especially in the ancient time, we have the heart surgery and other things, which has been lost. Now,
Do you do bloodlettings? You're saying you don't do
no,
bloodlettings?
this we do it like heart surgery, eye surgery. This
Right.
has been practiced in the earlier time,
Oh, okay.
But now it's almost lost.
Oh.
So modern medicine jumped,
Oh,
So in
yes.
some way, this could be one reason, but some other reason, also some during the practice, there was some failure relating to the royal families. So the king banned. There were many stories.
Oh,
like
okay,
the
okay.
reason why it couldn't continue.
Of course.
So there are special dates where you shouldn't perform like
Okay.
surgery and other things,
Okay.
And if you go on that, because it's unlikely that you couldn't succeed with operation and other things, for
Okay.
instance. So
Okay.
these we rely on the astrological date, like movement of special energy according to the lunar months,
Okay. So you decide when to do.
Yeah, for
certain
instance, if
treatments.
this special energy today resides here in the crown of the
Okay.
head, So
Yes.
if you do the hair surgery, it's not a good date.
Oh, okay. The hair surgery. When is not a good day for a hair surgery?
For instance, because there is a special energy which moves every day for 30 days, in the
Right.
lunar month.
Right.
So the energy moves from one point to the another
Yes.
during the 30 days. So
Okay.
on the day this special energy resides, and maybe if it resides here today and you go for the knee surgery, that's not good. For instance.
Okay, that makes sense.
So we have to take the precautions,
Okay.
like
Okay.
that side,
Yes.
This one thing.
That makes sense.
Mhm.
There are American
Yeah.
herbalism, where they pick the plants on certain days. and-
Yeah, during the collection of plants, medicinal plants, during the formulation of medicine, when we do the external therapies, during the pulse diagnosis, we have to see the seasonal pulse.
Okay.
So that's the base. Otherwise, we might make mistake.
Okay.
It is
So you
the-
take the pulse too.
Yes. Pulse diagnosis. That is one of the main,
Okay.
diagnostic tool in Tibetan medicine. Pulse and urine examination.
Pulse and urine examination. Oh. Okay. Huh. That's similar to acupuncture. Well, not the urine, but they take the pulse.
Yeah,
Acupuncture.
acupuncture, I think that's very less,
Okay.
They will just focus on the meridians,
Is there any relationship that you like a really obvious relationship
But there's-
between Tibetan medicine and acupuncture?
There are some points
Okay.
which go inside exactly the same. But
Okay.
the medium which we use might differ, how
Okay.
it developed,
Of course.
Yeah, but some points exactly the same and same indications,
Okay.
where we might use moxa rather than the acupuncture itself,
Okay.
Yeah.
Interesting. Okay.
So basically in terms of Tibetan medicine, we have to judge this in terms of the elements and in terms of the energy systems.
Okay.
So I can't tell you very precisely until and unless I go with the full diagnosis in general.
Of course.
Basically, like Ayurveda, Chinese medicine, Tibetan medicine, because we all deal with the three important energies. In Chinese medicine, they talk about the yin, yang, and qi. In
Okay.
Ayurveda, they talk about Tirdosh, Vata, Pitta, Kapha.
Right.
And in Tibetan medicine, we talk about Lung, Chiba, Pagan, Three Nyepa.
Okay.
So basically, these are more or less the same. Only there may be some variations in the way of interpretations,
That
in
makes sense.
in terms of depth,
Yes. Yes.
Otherwise, more or less the same. If you have good understanding on one system, then you can catch other system quite easily.
Sure. Sure. Okay. But
But right
Okay.
now, because these days I'm quite busy because I'm doing this overtime job because I'm in the health committee of exile government,
oh, so you work for the government too?
Normally not.
Oh.
But these are for a short time, like 4 or 5 months for health review,
Okay.
how we are going on here in the Tibetan settlements or wherever in terms of modern medicine and Tibetan medicine, especially in the case of preventive health care,
Huh.
So His Holiness has strongly emphasized that we have not done up to the expectation, his expectation.
Oh.
So the exile cabinet, they form a review committee. So I'm one of the members.
Okay.
So
Okay,
very
that's-
busy, So we are supposed to keep the full report and recommendations at the end of this month,
Oh,
So
okay. So you
I'm
are
here.
very busy. Okay, fair enough. Fair enough. I'm sorry to bother
No,
you.
that's okay, no problem. Normally I love to interact,
Yes, yes. Well, I do a blog, and I would like to direct people here. I guess is but appointment only. Because the place down the street, it just this seems much cleaner and much nicer to me.
It's more welcoming for sure.
Yeah.
Yeah, much more
And
welcoming.
so
Yeah, quite a lot
And
of
you've got
students around the world,
Books.
Yeah. You're from US?
yes.
Okay.
Yes.
So I taught quite a lot of students from the Minnesota University.
Oh, really?
Yeah.
Okay.
There's a special section on the spirituality, They
Okay.
come almost every year,
Huh.
And there's also students, international students, study. SITs, study
Sure.
international, They are groups,
Yes. Oh,
This year
yes.
I taught 3 days here for the group from the United States. I think the
Okay.
man who is the director is from the Indian origin, American.
So do you take students where do you teach? I mean, like if a student came here from the United States,
Yeah.
you would teach them.
Yeah,
Okay.
I have helped a lot of students who are doing the research, especially doing thesis on the traditional medicine,
Okay. Okay. Fair enough. Then I'll put that on my website.
Okay, perfect.
Direct more people to you.
Yeah,
Yes.
yeah.
I appreciate you sitting down and talking,
Yeah, you're welcome.
and I'm going to buy your
Okay.
books.
So this you can go for 500,
Yes.